guys, this is the musculoskeletal assessment. Today we're going to be looking at range of motion in our patient Nico here. Going to be assessing for any pain, tenderness, popping, cracking, anything kind of abnormal there. So we'll start with our spine. So if you want to kind of turn this way and then just bend at your waist like you're going to touch your toes and reach, good. And that is flexion. If we bend our back this way for extension, good. And then face the camera for me here. And then do lateral bending. So kind of turn your shoulder, yeah. And then repeat that on the other side for me. Good. We can check for spinal rotation. So if you take your shoulders and kind of twist one way, yeah. Good. And that's intact. So then we're gonna do our shoulder joints now. So for flexion, if you can put your arms out in front of you like this and raise them all the way above your head, that's flexion. And then if we bring them down past our hips, that's extension there. Good. We can also do external and internal rotation. So external, you would just put your hands on top of your head like this, rotating that joint, and then put them down like you're gonna touch your hands behind you. Good. All right. And then we can do abduction and adduction. So abduction would be away from the body if you go like this and touch the top. Good. And then adduction back down. Perfect. Okay. Now we can do the wrist and the hand. It might honestly be better if you turn a little bit on an angle so the camera can see. Good. Okay. So for wrist flexion, we just bend our arm down like this. Extension is upwards. Good. And then go back flat for me. And then we can also check at the metacarpal. So if you bend kind of at that joint there, yep, and then extend, good. We can also test for radial and ulnar deviation. So for radial, kind of bend that hand flat towards you, good. And then on the pinky side for ulnar, good. Yeah, then we can spread our fingers apart and back together. Make a fist for me. And then can you touch your thumb to each finger? Good. And then this pinky joint here. Perfect. And I would repeat that on the other side. If you want to, well, let's do one of them standing up. So we're going to assess our hip joints now. And again, repeating this on both legs, but maybe flexion. We can test if you would put your leg out like this, give you some room there, and then extension kind of back behind you there. Good. Okay. If you want to lay down, we can do the rest. It'll be easier. Kind of hard to balance. I think we can see here. That's good. Okay. So we could test flexion lying down as well. So just kind of relax your leg and I'll do the moving for you. So this would be straight leg flexion. We can also do bent knee flexion as well. While we're here, we can do external rotation, so away from the body, and internal rotation, kind of in this way. Good. We can also do adduction and abduction. So adduction would be towards the body. Good. And then abduction would be away. Okay. And you can go ahead and sit up.